morning, everybody. I see people joining our event this morning. Thank you very much for being here. I am Natalia Allegretti. I will moderating this session dedicating to understanding stress, burnout, and resilience among nursing and medical professionals in Europe. I am a Senior Innovation Project Manager at ECH Alliance, which is one of the partners of Keep Caring, that, as you can see from our background, is really the framework in which this discussion will be held. Before starting and diving in the conversation today, let me give 2 or 3 tips about the housekeeping of this morning. So this webinar is recorded, and its recording will be posted on the project website shortly after this event. While we go through the presentation, please turn off your camera and mute your microphone. As you have seen from the program, there is a question and answer session at the end of the discussion. So if you wish to put your comments and questions, please use the chat box that you have in the bottom bar of your screen. And also note that captions are available. If you want to switch them on, please click on Show Subtitle Captions in the bottom bar to enable automated subtitles. The program of today has been shared with all of you, so we will have a first part dedicated to presentations from our panelists that in a minute I will present to you, introduce to you. Then we will have a live question and answer session, and then some final remarks before we say goodbye. Without further ado, let me introduce our panelists, our speakers. So let me start with Professor Stephen Gallagher, Professor of Psychology at the University of Limerick, Anna-Lena Ursula Markowska, MA and Certified Psychology Counselor at the University of Tartu, and then Dr. Trina Tamrakar, a postdoctoral researcher at the University of Limerick again. So I think that now we can give the floor to Stephen, who will tell us a bit about the Keep Caring project and give us some background and science in relation to burnout in view of hospital staff. Stephen, the floor is yours.
Thank you, Natalia. Appreciate the introduction and the invite for this important webinar. And welcome to everyone. I know you're very busy, so thank you for taking the time out of your busy day to attend the webinar. I am a professor of health psychology, and I'm the lead for Work Package 2, which is looking at the resilience and burnout in hospital-based healthcare workers with a specific focus on surgeons. And this is part of the whole of Keep Caring. And so this is the first work package, and it's looking at, as I said, burnout and resilience. And so hopefully by the end of today's session, you'll understand what this particular aspect of Keep Caring is all about and where we currently are. So I just want to move on to the next slide. It'll take a few minutes. Oh, great. So why are we talking about this? If you're working in a hospital already and you're listening, you'll be very familiar with what's going on currently in the healthcare sector, whether you're a surgeon, you're a nurse, or maybe you're a hospital manager. You know, our healthcare sector is in crisis. It's been in crisis for well over a decade now. So we have issues with recruitment, we have issues with retention, and again, there's poor job satisfaction. So our healthcare sector is not attracted to new workers coming into our system. It's not seen as a good career choice. And again, for those currently working in the sector, you know, increasing numbers of those healthcare professions are actually having a greater intention to quit and want to get out of it. So these, as I said, are not new, but they really came to the fore during the pandemic, where we see this higher rates of burnout and highlighting the seriousness of the situation. So our healthcare professionals across Europe are facing increasing pressure, those staff shortages, rising patient demands, long hours, and a big increase in emotional load. So while our doctors and nurses are highly committed, many are facing or hitting a wall, and burnout is on the increase. I'm just going to give you some kind of like statistics for this. So in Ireland, for example, a recent survey, I mean, like in 2022, 89% of those surveys reported high amounts of burnout among our nurses in Ireland. And again, for Irish medical doctors, another survey revealed 70% of those surveyed reported high amounts of burnout, all linked to the working environment. And importantly, comparing data from 2014 to 2021, there was an increase in about maybe 30 or 40%. So it started off at 40% in 2014 and 79% in 2021. It's high increase in burnout. And again, looking at our EU colleagues, in Denmark in 2024, a survey revealed 50% of surgeons reported a high amount of work-related burnout. In the Netherlands, 30 to 50% of surgeons reported burnout. Again, in Germany, it's about 60%. And I'm mentioning these countries because this is where our hospital sites are and our key partners are. We're looking across Europe, but I've just picked those as an example. And it's seen echoed across the EU. So I've just given you an example of some of these. And in terms of burnout, it can manifest itself as emotional exhaustion, so increase in anxiety, depression, depersonalization, which is detachment from patients and colleagues, and reduced professional efficacy. So how competent people feel in how they're able to do their job. So these negative experiences of burnout are all linked to job retention, recruitment among our surgical and non-surgical specialities, with other studies that are funded by the EU looking at intention to quit. And again, that has been on the increase as well. So it's a big concern. And again, you can see why it's worthy of investigation and better understanding. And that's the overall aim of Keep Caring, to understand what are the factors contributing to burnout, and again, how can we mitigate against it? So we have particular focusing on looking at resilience. And you might say, what is resilience? Resilience refers to the capacity for people to overcome stressful situations and to adapt positively to these challenging situations, which results in a better emotional and psychological well-being. So we know the stresses are still there, but it's helping people to manage them. And resilience is one concept. Now, it has been debated, is it like a personality stable trait that it's not fixed? It's something genetic. However, more contemporary research suggests that it's actually malleable. We can learn it. It stems from past experiences, work and social experiences, and learning. So we can shape it. And there are studies showing that it's actually can be developed into an intervention. That's a key focus of Keep Caring. So you can see why the EU is really interested in all of these factors, and Keep Caring is one project that helps us to make our health systems better, to help people cope and manage. So there's a lot of theoretical stuff behind all of this. So I'm going to pass you over now to my colleague, Ursula, who'll give you a little bit of background to the theoretical background behind Keep Caring survey.
Yes, hi. Our slides are stuck. No? But welcome. Good morning, everyone. Thank you from me as well. As Stephen already said, my name is Ursula. I work at the University of Tartu. And before that, I have worked as a work psychologist in one of the biggest hospitals here in Estonia, doing counseling for medical professionals. And that's why this Keep Caring project is actually very, very important from me and has a really special place in my heart. But today, I want to introduce you to a powerful framework that helps explain why healthcare workers or all workers strive or burn out under pressure. And it's called the Job Demands Resources Model, or JDR model. And now the slides are stuck. No? Oh, yes, thank you. So let's unpack why this burnout happens, and using the JDR model as our guide. And it might seem a bit theoretical, but trust me, it's really highly relevant to your daily experiences, and especially in the healthcare section. So The JDR model developed by one of our colleagues working in KEEPCARING as well, Arnold Bakker and Evangelia Demaruti, I hope that I pronounced that correctly, gives us a way to understand employee well-being and performance by looking at two things. So basically, we are looking at the job demands. These are the aspects of your job that take your energy away. And then resources, so the aspects of your job that give you energy. And under the resources, we have job resources and personal resources. So job resources, the things that your job or organization gives to you to help achieve your work goals, and then your own resources, the things that you have to have the energy for the job demands. So we can think of it like a scale. So one side there are demands, and the other side there are resources. And if the demands outweigh the resources for too long, that's when the burnout creeps in. The JDR model outlines two core processes. One is the health impairment process. So when there are high demands with too few resources, that can lead to stress, fatigue, and burnout. And then there is this motivational process. When resources are strong, then even in a demanding job, people feel motivated, engaged, and effective. So if you think about it, the goal isn't to remove all the demands. This is healthcare after all, but the goal is to balance the scale by strengthening the resources. And now that we've talked about the JDR model in more theoretical terms, let's take a quick look at what it looks like in practice. And I'm using here this visualization from also Arnold Bakker and his colleagues. And this might seem complex at first, but let's walk through it together. And if you look at it, then it's already like a scale a bit. So we have this red zone here, the job demands zone, we can say. And these are the things that increase exhaustion. So you see an arrow going from job demands to exhaustion with a plus sign, meaning more demands lead to more exhaustion. And when this builds up, job performance drops, and people can enter into this negative spiral, and exhaustion can lead to self-undermining behaviors like mistakes, more conflicts, avoiding tasks, etc. And that increases job demands even more. So the environment we are working on gets more challenging for us. And then the left side, or the green zone here, where there are job and personal resources, that's the part that boosts work engagement. So our sense of involvement, energy, and dedication. And resources also help reduce exhaustion. Engaged employees are more likely to show proactive behavior, helping colleagues, improving systems, and managing their own energy better, actually. So all that being said, what we at the University of Tartu want to understand now better is what are the specific demands and resources healthcare workers feel at the moment. And we hope to get a lot of insight from the study that my good colleague Katrina is going to talk about real soon, but we already know some things from the literature. So what do we know? What are some common demands faced by nurses, doctors, and other healthcare staff? Well, there is emotional labor, so the constant exposure to suffering, trauma, death. Then there is also time pressure and shift work, so irregular hours, long shifts. There are more understaffing now as well. So when you don't have the time to take a break or let alone finish some paperwork, then that's quite demanding. And also moral distress when you know what the patient needs, but the system ties your hands, so you can't do that. And we know that there is more bureaucracy and electronic health records today as well, and that can feel like there are more clicks than there are care. And those demands aren't just tiring, they are draining, and if unbuffered, they can lead to burnout. And when we look at the job resources specific to healthcare, then we can see that a really important thing is support from colleagues. So being able to debrief with a peer after a difficult case, or just talk about your emotions or things that are difficult for you. And also, we all know it, and I think we all have felt it, that the simple thank you from a supervisor or from a colleague can go a long way and help us a lot. So the recognition is also a really good resource that we can use. And if we think about it in real life, and to sum it up, we can think about a nurse working long shifts with constant emotional demands, no time to rest, and no support. And then we can suppose that that nurse is stuck in the red loop. So he or she might feel exhaustion and performance issues. And then we can imagine another nurse in a similar role, but who has peer support, some flexibility, and good supervision. And that nurse is more likely to stay in the green loop, engaged, performing well, and proactively managing his or her stress levels. And that's why we want to know more about the specific demands and resources in healthcare, because when we know that, we can actually design better interventions and guidelines for healthcare to help buffer the demands and boost resources. So that's the part we're really interested in, and that's one of the things that we want to do in Keep Caring as well, to give the guidelines, to give the skills to buffer those demands and boost those resources. So I'm going to pass the word to Trina now, talking about linking theory to practice.
Hi, Ursula. Thank you so much for that. Hello, everyone. I'm Trina. I'm a postdoctoral researcher based in University of Limerick in health psychology. And today I'll be talking about linking theory to practice of everything that Ursula's talked about. How do we bring that into practice? How do we measure these concepts of stress, resilience, and burnout, which we'll be doing within Keep Caring. So that's the first research, and I cannot move my slides. So that's essentially that's the first part of the research work package. 2 is what within Keep Caring looks at how do we measure the current levels of stress, resilience, and burnout. And we do that through our current survey, which is grounded in theoretical practice that Ursula just mentioned. This research investigates current level of, like I said, stress, resilience, and burnout among medical professionals in Europe. And the modality that we do that is through qualitative as well as quantitative research. For quantitative research, where we have a survey that's circulating among hospital-based doctors and nurses across Europe. The survey is available in 11 different European languages, and it's still live. And it gives us kind of the snapshot of what the current levels of stress is, current level of burnout is, current levels of resilience is, which Stephen will be talking a little bit about. And we're using a lot of validated psychometric scales to measure that, which I will get to in a minute. And that's followed by qualitative studies, which is one-on-one interviews to kind of complement the survey data, because surveys cannot capture like the nuances. So the qualitative studies and the interviews are to capture the nuances and the depths of personal experiences of what nurses in Ireland or doctors in Denmark, for example, are going through. What are their personal experiences of it, to kind of add a lot of depth and nuances. I'm the one who's conducting the interviews, and that's also ongoing at the moment. Finding a lot of depth. So how do we measure these? The first one is resilience. For resilience, we have used short resilience survey, which was developed by Morgan and colleagues. And what does it capture? So it captures 2 concepts, which is decompression and activation. So just to give you all kind of, not to make it completely boring, I will just give you examples of what each scales capture rather than get into the nitty-gritties of the validation of these scales. So it captures two concepts of decompression and activation. Decompression essentially means that you're able to kind of decompress and recharge without any of the stresses of work. So an example of this is I can take time off of work and enjoy my personal time, or when I'm taking my time off, I don't think about work at all. So these are people who can completely, unplug, so to speak, from work-related stress, no matter how stressful the work environment is. And then activation is an example of that is I care for my patients even when it is hard. So even when, the work environment is stressful and there are many patients and you're overworked, I'm still able to have some level of empathy and treat the patients as, human beings as opposed to patient number one, patient number two, so having that level of empathy still active is also a sign of resilience. So in terms of work stress, we are using the Health and Safety Executive Stress Tool Indicator, so SIT 25. We've used a shorter version of it. The longer version has 35 questions, but where possible, we've used shorter versions of validated scales because we have several scales in the survey and we've tried to put it under 12 minutes, and they're busy people, doctors and nurses, as you all are all aware. So we wanted to make it kind of, time, but it also kind of captures everything that needs to be captured within this. And interestingly, this is SIT 25 is based on the JDR model that Ursula just talked about. So it covers those 7-factor model, which is the job demands, which is different groups at work demand different things from me that are hard to combine. So this might be a nurse who is pulled in many different directions or many different departments demanding their time, and that can be a contributing factor for stress. In terms of control, an example of this is I can decide when to take a break. So this could be, for example, if you think about it, if it's in the same operating theater and there's an anesthesiologist, a doctor, who can decide that, okay, I can take 25% of my time to do research and then only 75% time to do surgeries, versus a nurse who is fairly low on the food chain, who has no control over where their schedule, when they get time off, who they work with, and they're essentially just assigned, and then, they don't get time off when they've planned a holiday, for example. So these are lack of control of your schedule, lack of control who you work with, and all of that could be contributing factors to stress, regardless of, it might be the same operation theater, it might be the same surgery, same stressful environment, but the control and lack of control could be a contributing factor for stress. And then managerial and peer support, an example of that is I can rely on my manager or colleague to help me out with a problem versus, I cannot rely on anybody at work. Role clarity, I'm clear of what it expected of me at work, versus, I don't know what I'm doing at a job. And I think this is kind of stressful for anybody in any work environment if they don't know what they're doing at their jobs. Relationships, work relationships, there is tension among colleagues versus, there is, amicability and a good teamwork among colleagues is an indicator of stress. And change, which an example of it is staff are always consulted about change at work versus, there's a merger between two hospitals happening. And for example, you get 2 days notice about it. So you have to kind of wrap your head around the fact that, oh, you're going to be working with this completely different department or these new people that you don't really like, but you have to now work with them on a daily basis. And, oh, you have like 2 days to process that. So, so like being aware of the changes and being unaware of the changes also are a contributing factor to stress. So how do we measure these? Another one is burnout. So for burnout, we have used BAT, Burnout Assessment Tool, also 12. This is also a shorter version. The longer version has 23 questions, Shofili, and it essentially captures the 4 different kind of aspects to it, which is exhaustion, mental distance, cognitive impairment, and emotional impairment. Exhaustion is fairly self-explanatory. At work, I feel mentally or physically exhausted. Mental distance is somebody who is kind of checked out. So this is kind of the biggest indicator of burnout, I guess. So an example of this is I feel indifferent about my job, or I'm at an autopilot mode. So if somebody is completely checked out, who will be doing the job but is not fully present, is one of the biggest indicators of burnout. And that can be an occasional thing, or that can be a regular thing as well. Cognitive impairment, an example of that is at work, I have trouble staying focused. And emotional impairment is during my work, I become irritable when doing things don't go my way, or I do not recognize myself, the way I react at work emotionally. So, this could be somebody who is reacting to normal stresses at work. They are reacting more than necessary, or abnormal reactions to normal events, so to speak. So these are people who are already on the threshold already, and some things that happen that break the camel's back, so to speak. So that is an indicator of burnout as well, emotional impairment. So leadership styles are, we have two sets of scales that measure leadership styles. This is research done by Work Package 5, University of Cumbria, who are partners of Keep Caring, and Diana, professor, she is an expert in this, in this subject matter. And it's the two scales that are included are toxic leadership scale and dirty dozen scale. Dirty dozen scale essentially measures toxic deviant traits in leaders. And Diana is an expert in this, and I'm sure there'll be a webinar that will talk more about what essentially this comprises. But we have only one survey that goes in with Keep Caring, so we've included that. Our research mainly focuses on burnout, stress, and resilience, which I've just talked about. And now I would give the baton back to Professor Gallagher here to talk about our findings.
Thanks, Trina, and thanks, Ursula. As you can see, just before I move on to the kind of like where we are, the results, you can see kind of this particular aspect of Keep Caring is sound in terms of theoretical underpinnings, and again, the measurement of those concepts within the theory. And this is really important because this is where you can identify what are the drivers of kind of low resilience and what fosters resilience, because that would feed onto the development of those interventions. So that's why it's really important to have a kind of strong kind of like theoretical background underpinning Keep Caring. And again, you have to have those measures of capturing those concepts so you can target, specific, the most important contributors to those resilience factors. That's why it's really important to have this methodology. And we're showing you, like, it's just us three, but there's a strong village behind us in terms of other researchers. There's loads of other academics. And again, in our particular work package, we have Nova, which is another university in Portugal, and Trina has mentioned Cumbria. Again, Diane, these are strong people feeding into this kind of strong theoretical background and methodological kind of underpinnings behind it as well. And we have other partners, the University of Amsterdam, medical centres, Rates Hospital in Copenhagen in Denmark, and again, UKE in Germany. And we have a lot of other partners help us with the recruitment, EFN, Nursing Federation, HOPE, all of these people. Without any of these, we wouldn't be here today, doing all of this. So there's a village response to all of this. And I know Deborah is project manager of Keep Caring, keeping us all on top, ensuring that we're actually doing it rigorously, robustly. And again, there's a whole PhD circle help us with the survey capturing, because they're not a medic, and there's nuances of who we get the data from. So without a doubt, I wanted to say thank you to all of those things. So we're surveys almost done, so I have some preliminary findings, and I have to capture it is preliminary findings. So we're the survey will be live for another couple of weeks, but we just pulled some data to see where we are. Is there something going on with resilience? Is there something going on with burnout? So what I did was as mentioned, we have 4 hospitals kind of countries, which are Ireland, the Netherlands, Denmark, and we have Germany as well. But Germany is just going live at the moment. So what we had to do is, as Trina mentioned, we had 11 languages. So we pooled all those numbers together into the other categories. So that would include Germany as well. And this is the scores on the resilience scale that Trina already mentioned. And you can see here, Ireland has the lowest level of resilience. Now, this is nothing new. This is replicating other studies. But in the Netherlands, Denmark seems to be the more favorable country, so the higher levels of resilience. And again, the Netherlands are much lower. Again, these are all statistical differences. So Ireland has the lowest. And again, looking at burnout then, again, we did this country level analysis. And again, Ireland seems to be the higher level of burnout. And again, the Netherlands is much, much higher than Denmark. And Denmark and the other are pretty much the same. This kind of echoes what's going on when you talk about, resilience being linked to burnout. Okay, so people who are high on resilience tend to be lower on burnout. Now let's look at, okay, is there something going on within the particular roles, doctors versus nurses, for example? And you can see here quite clearly, the medics, these are hospital-based doctors, are much higher of those of nurses. So lower levels of resilience in our nurses. So even though on the resilience is higher in the medics, when you look at the levels of burnout, eyeballing it, it looks as if it's different, but it's not statistically different between the two of them. Now, that might change based on numbers as the study's going forward. Again, as I mentioned at the beginning, we're very interested in the surgical versus non-surgical specialities. This is a resilience. And you can see here, those in the surgical pathways have higher levels of resilience. Again, looking at burnout, again, this is echoed. Those people who are in the non-surgical specialities are high in burnout. So when you think about this job demand resource model that Ursula was talking about, you talked about these personal resources, and we would consider resilience as a personal resource. And you can see it tends to kind of be characterized by low levels of burnout. So it is really kind of tapping into what we were trying to get in our theoretical framework. Now, there's a lot more to go on this. We have to do, what are the job demands, resources? What are the key drivers? Does it vary by age and gender? So these are preliminary results, but it does lend a lens onto what our theoretical framework is looking at. So we're in the early stages. What we'd like to do now, if anybody's on the call and they have connections with hospital groups or nursing groups or surgical groups in particular, please email us. The survey is still live. We really want to kind of reach out to those other groups to increase the number, to make it even more representative. So you can email us, we'll send you the survey, we have the links here. Thank you all for listening anyway, and I hope you enjoyed the presentation. It's giving you a snapshot of what Keep Caring actually is, and the scope and the depth and breadth of what we're trying to do. So I think we have a Q&A session now, so we're happy to take questions from anyone. So Natalia, I'll pass it back to you.
Thank you very much, Stephen. Yes, number of questions are coming through.
Okay.
So maybe we can start with numbers, Stephen. We have been talking about these huge, let's say, audience that answered that have responded the survey. How many doctors and nurses did we have so far?
Yeah, in total, we've got about maybe 1,300 to 1,200, but there's a lot of people start the survey and then they don't complete it. But in terms of doctors and nurses, we have about maybe 440 people who indicated they were a medical doctor, and we've got about maybe 580 who said they were nurses. Now, as I said, people will complete the questionnaire, they're tired, they're burnt out, but that's what the numbers we have at the moment in the survey.
Yeah, I think it is already much more than what we expected somehow at the beginning. So
yeah,
we already have created a huge impact. Which has been the recipe there to reach such a large audience, in your opinion? It's the interest in the topic, is because it's burning, really, as we said at the beginning?
Yeah, sometimes it is the topic itself, but again, without our actual our partners, because our partners will have links with those nurses and doctors on the ground. So it's promoting it, because they're the advocates for us. They're the people on the ground, because if you're busy and, just patient care is your priority, doing a survey is like an add-on. So without our partners advocating on behalf of Keep Caring on the ground that this is important, we need to tell our story. So it's probably the topic, as well as our partners promoting it for us, that are the key kind of things. And again, those people who are burnt out, or maybe you're not burnt out, you want to have your story told, how well you're doing, what is, all of these things are important. So it's the topic, the partnership, and wanting to tell a story from their perspective.
Thank you, Stephen. Then I think we can go to Ursula, because I've got two questions here to Trina, two questions here that might be linked one to the other. So you mentioned that interviews have started already.
Yes.
What have they been like? And there is any correlation with the theoretical model that also Ursula mentioned before?
Yeah, we're finding actually great correlation, not just with the theoretical model, but also with the research that is already the quantitative data. The Irish nurses that I've interviewed so far have displayed a higher number of stress and burnout. They are incredibly stressed, and I think it's part of it has to do with the hiring freeze that has happened in Ireland here. So they're overworked, so that is very much reflected. And then in comparison, the Danish doctors and nurses appear more more relaxed, more taken care of, more kind of, their support services are there, and they're not, they do not shy away from utilizing those support services when, a traumatic incident happens at a surgery or something. So it does appear that it is also, high in resilience is low in burnout, like the theoretical models have, displayed, and also kind of congruent with the data that we have so far, that the Danish doctors and nurses are showing better response, whereas the Irish doctors and nurses are clearly more stressed and clearly more burnt out, because they're overworked and they're doing 2 people's jobs or 3 people's jobs. So yeah, that's very, very reflective of the data that we have. I just noticed that somebody asked over there, are there any plans to explore the topic allied in health professionals within physios and OTs and speech and language therapists? I can feel that, if that's all right.
Sure.
At the moment, Keep Caring is focused on research based on hospital-based doctors and nurses. I mean, interestingly, this was conceived by doctors and nurses. Our main PI, Marlies, is a surgical doctor, so it's focused on, at the moment, it's focused on this population. We might expand to another one, but that's a consortium level decision that'll happen later on. So, but the focus at the moment is hospital-based doctors and nurses. Thanks.
Thank you. I see lots of questions coming, maybe one from Ursula, then we go through all the others. So Ursula, you mentioned that exhaustion impact job performance. Can you please talk more about it, especially what can happen in our care?
Yeah, thank you. Thank you for the question. There are actually a few things how exhaustion can negatively impact job performance in healthcare. We know that when we are exhausted and tired, then our attention and focus are reduced, and our memory is not that good, and our decision making is also not that good. And we know that tired staff are more likely to miss key clinical cues or overlook changes in patient conditions. Also, exhausted workers may forget steps in procedures or make slower, less accurate decisions. And as I said before, exhaustion can lead to these self-undermining behaviors. This irritability and detachment can lead to a snappy or unclear communication with patients and colleagues, so more conflicts. Miscommunications increase the risk of medical errors, especially during shift handovers and emergencies. And as I said before, fatigue is a major predictor of medical errors, documentation mistakes, and procedural lapses. So a lot of medical errors can occur when people in healthcare are exhausted and don't have the energy to do that job with all their heart. So we can think of it that way, that in healthcare, exhaustion is a patient safety issue, actually.
Thank you, Ursula. So let's go through the other questions. Then you decide between the three of you who is going to be answering. So what happens to be a key driver of resilience based on the survey responses received so far? Do the survey participants have any proposals other than what you have already mentioned? So there are additional, let's say, possibilities that we didn't think about it.
Yeah, I suppose because we're just in the preliminary stage, we don't have a full data set yet, and I'm kind of hesitant to go in and speculate. But we know, like, based on what we presented around the burnout, so if people have high burnout, they have low resilience, and vice versa. Now, as Ursula said, we're measuring, Trina said, we're measuring a lot of other factors there. The relationships within the hospital setting around colleagues. We have toxic leadership styles. And we know from the literature, these also matter for when people are actually, fostering resilience. These things do matter. Relationships with colleagues, being appreciated, being valued. And if you have, a negative manager, for example, or a hospital manager, these things are going to impact you. We talked about the determinants of resilience, and it is linked to social, your past experiences. So more experienced medics and nurses, because they've been in the job, they've seen trauma, they've learned from all these negative, stressful situations. We know factors like these are important, but in our own data set, we haven't actually done all of that analysis yet because the survey is not finished. We don't want to be jumping the gun. So we want to, but theoretically, we know these things do matter. I mean, you would expect them. And we've just shown you preliminary that burnout is characterized by it's linking to resilience, high and low resilience in that case.
So we didn't have any surprise so far in terms of answers that we have received. Everything was quite expected somehow.
Yeah. And in the qualitatives of Trina, they'd kind of hint that there's differences between the Irish context and the nurses, and what is the nuances of those particular stressors that are, causing the low resilience. So yeah. I think the interview stuff will really add that richness as to what specific ones per country that should be addressed or targeted.
Trina, do you want to add something?
Yeah, it is. That is essentially what it is. It is the there's a lot of depth. There's a lot of, like, without going into too much detail, so far we have 10 interviews, and we would love to have more. We would love to have more from Denmark, from Netherlands, and from Germany, our other two main partners, or any other countries. If anybody is interested, please feel free to email me. My email address is just down here. Who would like to speak more about this, and if you're a doctor or a nurse based at a hospital. It is quite evident that other factors do affect, like, work relationships are important, leadership is important. Without giving too much detail, there was one interview where a leader which was very, not that great, for lack of a better word, was a driving factor of stress for this particular individual. So all of these are very, very important, and we're finding examples. The more I talk to doctors and nurses, the more I'm finding that there are these nuances and examples of how important each and every factor is: work relationships, supervision, just having control over your schedule or not having control over your schedule. All of that is extremely important. I've also noticed that there's a question specifically for me. Did you observe strong reasons that healthcare professionals keep connected to their work? I'm happy to answer that.
Yes. Trina, please.
The question is, during your interviews, did you observe strong reasons to keep healthcare professionals connected to their work? Yeah, actually, it is usually the passion for their jobs, the nurses, wanting to care for their patients, and liking the fact that they're contributing to people's care and saving lives. With the doctors, it's similar. Some people who are in the operation theater and surgical theater, they specifically enjoy like the thrill of it, the thrill of saving lives, and being able to do this, enjoying the surgical procedures and being able to save lives. Those are the driving factors that kind of keep them connected to their work and keep them going. Thanks.
And did you look already into differences, burnout, like vicarious trauma, compassion fatigue? This is one of the other questions that we have. No,
we didn't. And I think it's really hard when you're trying to kind of create a survey that is theoretically sound and you only have like 12 minutes. And we spoke to our kind of partners around how busy would nurses be? How long does a survey have to be? They said anything that goes beyond 12 minutes, you're going to have low uptake. So we had to compromise what we could squeeze in, but keep it theoretically and robustly sound. So while compassion fatigue is really important and vicarious trauma, these are other additional things that we had to compromise based on all of those. And as Trina said, even the scales we used, we had to be very selective to get the briefest scale possible to do all of these. But these things are actually important. But we focused on kind of like the drivers of resilience, things that we could actually identify that would help us for interventions for the other work packages that we'd be focusing on. So we didn't, and that's the call we had to make. In any research, you don't have time to be doing everything. It's the burden on participants is really important. And I suppose which dimensions are significant influence, burnout and resilience. It's like the first question, like we still have to go in and analyze the data, all that theoretical model, the jobs, demands model. We have to go in now and look at what specific items or concepts on that scale are actually driving the resilience. And again, how is that related to the burnout aspect of it? Because that's going to be really important for identifying or informing where we target the interventions. Is it the leadership people? Is it like the higher level stuff? Or is it individual perceptions of changing people's perceptions on their relationships with your colleagues, around the jobs, the demands, whatever that might be? That's the next phase is going to be really important in identifying those particular components of the scales we're measuring to identify what are the drivers of it.
And I think this was a quite complex questions, and there is a second part, maybe you already answered somehow, but which are the dimensions that have greatest impact on burnout and those who are more relevant on resilience? We understood that there is a huge correlation. If you are burnout, you are not resilient, more or less. This is the message here, but I don't know if you can go dive deep.
Like there are subscales in the burnout scales and in the resilience scales that we have yet to analyze as well. I just didn't have time last week when I was putting the slides together and making out the bar charts, but these are really important questions, because which component of the burnout is driving the resilience and which aspect of the resilience is most affected? Is it my ability that I can't kind of like decompress in the evening times? You know, that work-life balance is really important, or I'm ruminating and thinking about it. We have to, that is the next phase, but we want to get more people into the survey initially, so we can, if there's people on the call who would like to take part or can distribute the survey, we'd be most appreciated. But in the next phase, we're hoping in June or July. So hopefully the next seminar series or webinar series will have more and more. So keep tuned to this, because those questions will be answered in the next phase.
I also have something to add.
Please.
Another one that came from the interviews actually was that administrative burden. If they feel a lot more hurdles with work, or if there's like additional procedures and all of these procedures which are perceived safety. These are words from the doctors, not me. Perceived safety procedures that are additional to the things that they already do that adds to their stress. That is, and then things that they know that it's certainly not, it's not contributing anything to the safety because they're already kind of doing that, but there's more tick boxes to do, more paperwork to do, more, one on the paper and one online and things like that. So that just, they're already stressed out with work and with hours and with, doing a lot more in their day. And then like the administrative burden, additional ones are definitely, like more protocol and procedure are definitely something that eats up their time, and to give quality care to the patients and the work that they're actually passionate to do. So that when time is taken away from that, that's also a contributing factor towards stress, I would say. So that's what I've observed from the interview so far.
Thank you very much. Ursula, would you like to add something before we go to the closing?
No, I think that Stephen and Trina already said everything. I think that it's good to see that what Trina talked about just now is actually the same thing that we see in literature, that this burden that you have so much bureaucracy is demanding, and yeah, it's what might play a role in the burnout as well.
Thank you. We just have a comment and the latest questions. Is resilience and burnout addressed specifically among nursing students? And if so, how?
We don't have enough data with nursing students. We have, I think, maybe 12 nursing students. So that's not enough for us to run an analysis. So we don't have, unfortunately, we don't have enough data to answer that question yet.
So please, as Trina said more than once, if nursing students are on this call, scan the QR code and answer to the survey. We will be pleased to manage and analyze your data. And then we have a statement, which is perceived safety procedures. That's an interesting point. So I think this is something that has been liked a lot. And with this, if no further questions are coming or comments, we just would like to thank you so much. First of all, our panelists today, thank you very much for your work and insights that have been given today. Just let me thank the audience. We had a huge audience, about 65 people were connected this morning. So thank you so much for joining us and for having this lively, let's say, discussion with us. As stated at the beginning, this is the first webinar in a series. Keep Caring is dealing with a number of clinical study. The clinical study presented today in terms of preliminary results and methodology applied is the one which is more mature right now, but obviously we will have additional insights, as also Stephen said, soon after the summer, and we will be pleased to share it with you. And also we will present the additional studies in the next future. So to stay tuned with us, please sign up to our newsletter, just scanning the QR code here. And with this, thank you so much again. Have a lovely day. Thank you.
Thank you.
Thank you, everyone.